Every single dentist is at risk every single day of being investigated or shut down due to not following state and federal regulations like OSHA, HIPAA, and infection prevention. Well, now, while you might feel confident about your practice, a survey conducted and published in JADA indicates that dentists fall short when it comes to infection control and following CDC recommendations. As a certified speaking professional, I've conducted over 1,500 presentations over the last 16 years on how to comply with these complex regulations. My audience members report 3 things when they get back to their practice. 1, they have more confidence. 2, they can immediately implement an action plan. And 3, they can provide every single patient with a safe and secure visit every single time. Dentists who are being investigated, facing citation fees, fines, and settlement matters will call me and ask for assistance on how they might be able to resolve their compliance issues. Here's 7 questions to ask yourself before you find yourself under the magnifying glass. Question number 1. Do you have an up-to-date OSHA program with an OSHA manual that's personalized for your practice? Have you distributed and collected all the required documentation and record-keeping forms? Have you offered your team the hepatitis B vaccination? If they decline, did you remember to get their declination in writing? If you don't have an up-to-date OSHA program, there's many resources that are available. You can go to the OSHA website, you can go to ADA and purchase their products, and then the Organization for Safety of Sepsis and Prevention has a wonderful kit that you can use to bring your office into compliance with an appropriate OSHA program. And if you need some hands-on assistance, you can hire a consultant like myself. Question number 2, do I conduct background checks on potential candidates for hire? Do I collect continuing education certificates, CPR certificates, and X-ray certificates? And do I know that the people that work for me have licenses that are current and up to date? Question number 3, do I provide all the appropriate and required personal protective equipment? And do my employees wear the proper PPE for the task? Am I following OSHA regulations for laundering and maintaining protective attire? Question number 4, are we exhibiting proper hand hygiene procedures? Do we spend enough time washing? Do we always wash our hands before and after glove use? And do we unknowingly touch items, potentially causing cross-contamination? Centers for Disease Control recently launched a campaign called Clean Hands Count. It's a campaign that's designed to empower patients to ask their healthcare providers to clean their hands. Does this mean that patients are worried about us? Question number 5, does my infection prevention program really measure up to the CDC guidelines and recommendations? Are my team members familiar with those recommendations? And are we following all the state regulations for patient safety? CDC recently released a publication, and in that publication, it recommends that every single dentist appoint 1 person to be the infection control coordinator. Have you appointed someone? Does your infection control coordinator understand his or her responsibilities? If not, you can go to the CDC website, and the new publication provides a summary, a checklist, and it highlights key points that you can use in your practice to make sure your infection control program really does measure up to the CDC guidelines. Question number 5, question number 6, have I conducted the appropriate training for my team members, the OSHA infection control and HIPAA training? Training increases confidence, it reduces errors, and it creates a culture of safety that patients both appreciate and most certainly deserve. Due to breaches in infection control, several patients and dental workers were infected with hepatitis B. And in Tulsa, one patient was infected with hepatitis C. Dental professionals must always be focused and extremely vigilant when it comes to infection prevention. And the ways to do that would be attend infection control courses, demand that your state association provide those courses for you. Make sure that you download a copy of the new CDC publication with the summary and the checklist so you can go back to your office and make sure that your procedures and protocols do measure up and are completely safe for patients. The final question, question number 7, am I HIPAA compliant? Do I have an up-to-date HIPAA manual with procedures and policies that are personalized for my office? Have I conducted workforce training? And do I know where the gaps in security are for my dental patients' data and where there might be vulnerabilities that data might be misused? You can provide a safe and secure dental visit for every patient, every time. The resources are certainly available. But if you need help, call me. Because when I'm not out rescuing and training horses, I rescue and train dental professionals.